Hi and welcome to Lessons from the Grand Rounds. I'm Dr. Sameer. I'm currently SR1 at RGCIRC New Delhi in the Department of Hemato-oncology and Bone Marrow Transplant Unit. So in this short video, I'll be guiding MBBS students regarding an approach to hematology and to get more and more exposure about hematology during MBBS days so that you learn about the basics of hematology with all the book materials, whereas the posting exposure during your MBBS days, so that in future you come to know about, you're more exposed about the branch, since both the branches, hematology and oncology, they are very unique, new, dynamic branches with very limited exposure during the medical college days. So we'll be dividing this video into two parts. First will be the book material or the reading material or books, and the second part is how you can approach during your postings. In the first part regarding books, we have four uh, reading sources or reading material. The gold standard two or the Bible two books are Robbins and Cotran, the pathology book, and the second one is Harrison's. So I found out Harrison Robbins to be the most important books during the MBBS days, because it covers a lot of clinical points, it covers a lot of pathology points and image based points, peripheral smear, histopathology, classical photos, so bite cells, spur cells, acanthocytes, your sickle cell, all the all the classic photos are there in Robbins, and they are also the major source of forming the image based questions in your entrance exams. So I feel that the amount of concepts, pathogenesis and clinical features in Robbins is one of the very good source to learn hematology. The second point is Harrison. So Harrison has divided that part into two parts. It is there is a part of symptomatology where there is topics on approach to anemia or anemia, thrombocytopenia. So in those topics, in the initial part, they have given you good algorithms to approach a case of anemia, approach a case of thrombocytopenia. And in the core hematology part, you have chapters on lymphomas, you have chapters on ITP, AHA. So whenever you see some cases in your ward, in your OPDs, you can read about them simultaneously and then correlate things. That is the best part for you. The third reading source will be Hofbrand's Essential, a very important book, but only if you have time you can read it in final year MBBS or internship days if you are very much interested in hematology. And the fourth book, if you are very much interested into lab hematology, peripheral smears, and some interesting photos of peripheral smear or histopathology, is the book Blood Cells by Dr. Barbara Bain. So first two book or sources are very much essential, that I feel that you should not skip or replace Robbins and Cotran's by any other book. I don't want to name the books, but I feel that this is gold standard. The second part will include the postings. So when I used to be there, I used to have an habit. I was very much lucky to have a very good bunch of batchmates in my postings, where we used to attend emergencies also similar to how the medicine residents or the surgery residents attended. So we saw very unique, beautiful cases during our postings. So I feel posting is a part where you should get exposed to a lot of things. So the first scenario will be exposure to peripheral smear microscope. So for example, you have a case of suspected acute leukemia where you have hemoglobin of 5, platelet of 10,000 and counts of 1 lakh, 1 lakh 20,000. So the first and the most important thing which is done is peripheral smear is being made in the emergency e-lab. So there you can accompany, you can go and see when the slides are made, you can see how the slides are stained, how they are made. Then you can recognize basic cells, how a neutrophil look, a lymphocyte looks, normal cells. And on the smear, when you see on the 10x, 40x or 100x, or what are the differences and what are the points when you see the smears, and how do you identify abnormal cells or the most important cells which is blast for us in hemato-oncology. So I feel you should have exposure of peripheral smear, handling microscope, and seeing also routine findings like sickle cell or important histopathological findings also on the microscope. So in emergency and in routine pathology lab, you should go and see the um, uh, peripheral smear of the patients who are admitted currently in your wards or in your OPD. The second thing, the most important thing which I feel is the CBC report. So if you see a CBC Coulter report, you will have hemoglobin, WBCs, platelets, DLC, MCV, MCHC, RDW, MPV, and these small parameters which are there, especially the differential leukocyte count, these are a chapter in itself. So when you frequently see CBCs and if you're taught about in detail what all things you can rule out on the basis of CBC, so I feel you should see the CBC reports and see the basic reports like retic count, LDH, direct Coombs test, and then you should also go and see how they are performed and what are the implications of them. The third point is about the procedures. So at a medical college, most of the procedures are done by medicine residents. So you can go and see how a bone marrow is performed. So bone marrow usually has aspiration, biopsy. Some of the times when there's a dry tap, we take an imprint biopsy as imprint of the biopsy also. So when you accompany the residents during the procedures, you will come to know what are the common indications to do the bone marrow evaluation, why we are doing so, and how is the procedure being performed, what all tests are being sent, and what vacuum are being sent, what are the tests which we get instantly, what are the tests which takes time. The other important procedure is lumbar puncture, where we send fluid for cytology, flow cytometry, and we also give intrathecal methotrexate or aracisatarabine or hydrocot as a part of triple IT therapy. The other thing is what you should see during your posting is, for example, cases of anemia, pancytopenia, polycythemia, or thrombocytopenia. So whenever these cases come, you see how they are being evaluated, what all investigations are being done. You go back to Harrison, you see the algorithm to approach to anemia, thrombocytopenia, and you correlate them. And whenever you get some interesting findings, you go and see the peripheral smear, you go and see what all basic tests are. So when you, especially also a case of lymphadenopathy, which is a case of suspected lymphoma, so what all basic tests are then, what all evaluation is done of those cases, and what is the algorithm, and based on different cases which you see, you will come to know that the history of the disease, the complications will tell you if it is an aggressive disease or an indolent disease. So I feel with these points regarding the books and the postings, you will get a fair enough idea how to approach hematology during your MBBS days. Apart from that, if you have any doubts, please let me know in the comment section. Thank you.